Ryan, it's Dr. Chams. You did some damage here. The meniscus in the back here, you torn, you re-tore your medial side. If you look at it, you've got a big flap back here that we need to clean up. Here's your medial portion of the meniscus in the posterior horn. We'll clean that up for you. You also took a little chondral defect and turned it into a true grade 4 lesion, which means you got bone exposed. We're going to pick that to create some fibrocartilage. It's not big. It's about 4 millimeters, 5 millimeters, so it shouldn't be that bad. You're also starting to get a little bit arthritic on the tibia plateau. Look how soft that's getting. Let's take a shaver and start cleaning that up for you, and then we'll pick it for you. Where's the clean this chondral defect, see how big it ends up being. This is an area that we could certainly graft cartilage to. That's a big deal. It ends up being close to a centimeter. There it is. All right, let's go back and clean up this meniscus tear that you have. Big flap in the back. Alright, let's take the pick and microfracture that. Hold the scope. We're going to create some bleeding in this defect that you have. We'll take a mallet. We'll perforate that bone marrow where we get these stem cells that will come back in and heal in there. Put another one closer to the other side. Probably just need 2 holes. Fine, what that does is we take a shaver, turn down this pump. Show you what happens. It decompresses, and you'll see this these bone marrow cells and blood kind of creep in once we open the suction off. Just leave it. There we go. You're going to see these capillary bleeding and bone marrow cells kind of fill this in with blood. What it'll do is it'll slowly turn into fibrocartilage, and that's what we want. It'll differentiate. Good. That'll form a blood clot in it. All right, now let's go back and fix the rest of your knee. Let's look at the lateral side. See what damage we've done there. Bring this up and across. Well, first of all, let's take this ACL stump out. Here's your graft, and actually the graft vascularized pretty nicely. If you look at that red portion of it, remember this is a dead piece of tissue that over time vascularized. We'll go ahead and clean up the stump. Yeah, there's, see all those blood vessels, that's good. Tore right off the femoral side. Got a couple fibers still there. Little probe. Take some of that out in a second. Let's look at your lateral compartment now. Let's bring it up and across. Move that up for me. Move that up and push this down. So you've got a little degenerative tear here in the mid-lateral meniscus, but nothing much. I'll just kind of clean it up for you. take a probe and probe the rest of it. Like the rest is intact. The popliteus tendon, the rest of the meniscus looks sharp. The back, you've got actually healed beautifully back here, but you've got a new radial tear right in the front here. And you did a lot of damage since the last time we saw this knee. Had a large predator. So the peripheral, or the area that we repaired, healed beautifully. If you look at it on the bottom, it healed nicely too, but you've got a new radial tear here, so we'll take a large predator, start cleaning that out for you. That'll be a very unstable area in your meniscus. You guys got to open it up. You got to pull that ankle up towards the sky. Push it up. Pull it up. Go up by your kneecap, best cartilage we've seen so far. Really nice. The trochlea has a little ridge in it, so you can start doing your ACL now. The marker here. Have a sheet for down here. In the chair. All right, so we put your tunnel a little bit lower, and we were able to avoid that other femoral tunnel. That's a really nice looking graft you have there. We're going to go ahead and fix it on your tibial side, and we should be set to the impervious and the dirt gloves. So here's your ACL. Looks great. We've got a beautifully tight ACL. We can get you into full extension here without rubbing on that lateral wall. You'll see how beautifully tight it is there. It looks great. We'll take it down through flexion. We'll do the same thing. Wash it out a bit so you can see it. Here's your new graft. Looks good. Let me have a shaver in there. Keep it off. There you go. And here's your graft inflection. So we're in great shape here. You do really well. Let's wash you out. We're done.